Hey, so why don't we get started? Dr. Romero-Leggett, would you like to mention anything else? And I know you're under the weather, but as we start off with intros.
No, I'll just say hello and welcome again. And I know we'll talk about reminding people about the climate survey town hall, but just a super welcome to everyone. And also, as we have a countdown to your departure as the new dean in the new year in Puerto Rico, I just want to offer again my congratulations and gratitude to you, and we look forward to our continued partnership, even though you won't be leading many of these efforts as well. Thank you, Dr. Sanchez.
Thank you, Dr. Romero-Leggett. As mentioned, I'm JP Sanchez. I serve under Dr. Romero-Leggett as the Executive Associate Vice President of DI in the office, and I'm going to popcorn to Dr. Swan and then ask her to popcorn to the next person.
Hi, everyone. I'm Emma Swan. I'm the Strategic Support Manager for the Health Sciences Office for Diversity, Equity, and Inclusion. And I will pass it on to Rebecca.
I always forget to unmute. You think by now I know that too. I'm Rebecca Napier. I am the Vice President for Finance and Administration. I'm very happy to be here. This is just finishing week 3. So I feel a seasoned veteran now.
I'll go next then. Welcome, Vice President Rebecca Napier. We're honored to have you. What a pleasure to have you with us at the Health Sciences Center. I'm Lawrence Roybal. I'm with Dr. Romero-Leggett, Dr. Sanchez, and Dr. Swan over at the Office for Diversity, Equity, and Inclusion for Health Sciences. And I'll go to Anastasia.
Hi there, can you hear me okay? I'm Anastasia Romero. I'm a Master of Public Health student at the College of Population Health, and I'm the College of Population Health student representative. Happy to be here on the IEC as usual, and I'm serving on the Workforce Development Subcommittee.
Great. So we'll just take a moment to break in the intros. I know we have our Executive Vice President is here with us, who's going to provide a couple of updates and opening remarks, and then we'll go back to intros. Dr. Sardonis?
Thanks, everybody. It's great to see you all. Really appreciate it. I want to make an announcement first. I don't know if you've met Rebecca Napier. She's on. Everybody already said hello to her, I can tell. So good. All right. Thank you. She's doing an awesome job, and I'm excited to have somebody in that role. And she's really acclimating well. And she's humble about telling about all her background that fits well for this Inclusive Excellence Council. And someday she'll get daring and share about all the interesting dimensions of her life. So, but we'll save that for another day. Second, I wanted to thank all of you who've been doing a great job with the Health Equity Summit. And Gina, maybe you could, while I'm talking, Google that and put the link into the webpage. Yay, you guys did such great work that we have over 200 people signed up. And I'm sure we're going to have more. And the fireman doesn't let us get more than 250. So we still have a little bit of room. So if you aren't signed up, or if you have colleagues you want to make sure attend, I think it's a really terrific agenda. And again, if it wasn't for a number of you on this call who have made a difference, it wouldn't look as robust, where we really hear the community's voice, and your it's really just a terrific next step. So thank you again for everybody who participated in putting that together. And December 12th, we all can celebrate together at the National Hispanic Cultural Center. And so thank you all. This is government relations final crunch before we get into the session. I have a meeting with HED tomorrow to go over in more detail issues of compensation, which are my #1 issue. So we are trying to get faculty in the School of Medicine compensation and protected time for the 20% effort. The College of Population Health had a runway to hire 20 new people, and the runway stops unless we get more funding. So we will work on that as our second big priority. We have a number of RPSPs that are going to be brought up to HED next week. And those include health equity that a number of you have helped on. They include addiction and addiction consult center. They include addressing social determinants of health with educational initiatives. They include artificial intelligence and trying to educate our students and faculty in that area as a couple. There's dental clinics, there's Leo, there's many exciting things that we hope to get supported on that are new, and then there's some that are expansions of existing programs. This is crunch time on that. I will then in 2 weeks be meeting with the Legislative Finance Committee to update that. Yesterday, I met with the Chief of Staff of the Legislative Finance Committee's chair, George Munoz, to really reinforce all of the things I just said. We're also hoping that with the, it's a Hail Mary with the Medicaid supplemental funding but I'm feeling confident. Mike Richards is doing a great job, as well as many others on that. So hopefully that funding will help. Then that will help with staff in the health system and raises and things that have been put on hold, in addition to enhancing our quality, et cetera. We didn't get the greatest score. We got a bad score on Leapfrog. And we are kicking our quality team in motion. It's not our only score. There's Vizient, there's CMS. But as it relates to our strategic plan, quality is our #1 goal. And we really need everybody's input on how to enhance quality. We have a great quality team, but we need to do even better. And it's really everybody. It can't be hospital versus School of Medicine or some other kind of creative tension. And you all are about inclusive excellence. So I want to thank you for all what you do, but part of inclusive excellence is also how we communicate, how we collaborate, how we know how interdependent we are and need to hold each other accountable on things like this. So we'll have a lot more time to talk a lot more about other items, but I wanted to end on just gratitude for all you're doing. I feel like it's making a difference. Erica Richards is on the call. She's overseeing the accelerators. And one of the accelerators tracks is how do we make sure DEI is throughout all of our 7 implementation team areas. How do we align the goals of the IEC with that? So I hope you do set time apart from this hour where you can't get that kind of work done. People who want to help Erica, please volunteer your name because she's going to need your help. And really, I turn to this group all the time for these important topics. And we're going to need faculty, staff, and student input on this. And I also wanted to align with UNM 2040's. One of the 5 key things there is DEI. So we do a lot in this space. And if I had to say to this group, what is the #1 priority for inclusive excellence this year? What's #1? What would it look like? Then I would say, what are your 5 big things? And one tactic for each of the 5 big things. But I'm trying to encourage everybody to have a simple message. I think Kate Becker does a really good job at this. So she can be a role model of really saying, these are my 5 things. Finances, we're going to do the Huron quality. We're going to do Lobo steps. And she can just go down her 5. So what are the DEI big number 1 and what are the 5? Because I think that will help us all focus together on the critical things. Now, that's probably going to be informed by the climate survey, but not only, because climate survey is just one piece of data. It's an important piece, but you all have been working, you all hear other groups who didn't put their vote into the climate survey. And that's where I'll end. I'm glad that the climate survey is coming out. I'm glad we'll all be able to appreciate it. And we're going to have a town hall coming up next week on that. So hopefully as many of you are able to come would be great. So JP, thanks for your leadership as always. We're going to miss you. I can't believe you're going to go leave us and go to some other place, but want to appreciate you and your leadership. How many more meetings you got with us?
About, I don't know, somewhere between 30 and 60. It depends on how many meetings per day. But
I meant this group. This
Oh,
can't be
okay.
your last group with, like, is this your last meeting with this group?
I think this is either the last or second to last, but it's been a truly incredible group to be a part of since its inception. I just want to thank you again, Dr. Sardonis, for your leadership and really advocating for health equity. And for everyone to know, Gina has put the link again in the chat box. So in following Dr. Sardonis' request, let's get the word out. Let's get the best possible turnout. And if we reach capacity, Doug, is it possible for people to participate virtual or it's only in person?
Well, we have a we designed it, and you can look at the agenda. Okay. It's designed with very little big meeting discussions. And we get right into smaller groups. So I think it would be more awkward to do that. So again, it doesn't mean we can't have another one sooner. So, but I want to thank everybody who put that together. But let's give JP a hand, because I have a feeling this is his last official meeting, because the next one's scheduled in the holiday where nobody's showing up. And in January, he's going to be a busy dean running another place. And of course, we're going to all go visit you, JP. And so I'm expecting invites to that beautiful island that you're going to. And I love tarpon fishing there. So we'll work on setting that up.
Absolutely. I know there's a couple of people on this call that also go scuba diving. So it would be great to invite all of you to Puerto Rico. UCC specifically, thank you again for that heartfelt message, Dr. Sardonis, and Gina, thank you for always supporting the IEC. And we will definitely be out and present for the Health Equity Summit. We're going to continue going around the room. As mentioned, many of you are just starting now with the IEC family. I just put in the chat box some of the people that didn't have a moment to introduce themselves yet. So if you could just share your name again and the entity you're representing, and we'll start with, and also opt to just update your name on the image on webinar, but Minutal. Okay, maybe Helen, and then
I apologize. I heard Mina, but that's actually me, Mike Nuttall. Anyway, very funny. Nice to see you guys. I'm part of the IEC representing staff, and I'm affiliated with leadership at the hospital.
Excellent. Thank you. Welcome. And then Helen, Carlos, and Carolyn.
I'm Helen Nielsen. I'm part of the executive director team in this group. And then also I am the vice president of human resources for the UNM medical group. Thanks.
Hi, my name is Carlos Abekta. I'm the department administrator representing the staff, and I'm the department administrator for neurosurgery in the Health Sciences School of Medicine.
I'm Carolyn Montoya, and I'm the interim dean at the College of Nursing.
Hello, everybody. I'm Marcus Garcia, and I'm an ACERT fellow with the College of Pharmacy. and I'm the alumni representative for the organization. So thank you guys.
I'm going to just thank you so much, Marcus. Gina, I think you're up next.
Hi, thank you so much, JP. My name is Gina Urias Sandoval, and I'm the Chief of Staff for Dr. Zadonis here at UNM Health and Health Sciences. I regret that we couldn't stay for today. We have something we have to be at now, a Zoom meeting on a debrief, but I usually love to stay for these meetings. So thank you. Keep inviting me. Thank you.
Thank you, Gina.
Good afternoon, everyone. My name is Milly Castañeda Ledwith. I'm the Director of Community Engagement for UNM Hospital.
Then Pilar, Fabian, and Erica.
Hi, I'm Pilar San Juan. I am an associate professor at the Family Community Medicine, and I'm here as the representative from the CTSC.
Hi, everybody. Good afternoon. I'm Fabian Armijo. I represent UNM Hospital as one of the executives. So I oversee diversity, equity, and inclusion, and that includes community engagement, interpreter services, Native American health services, health literacy, and then all the DEI education for hospital staff. Good to see you all.
Hello, I'm Erica Richards. Thank you all for having me at this council. I am the Medical Group's VP for Health System Strategy and Business Development, and I'm here today related to the strategic plan, and as Dr. Ziadonis had mentioned, the accelerators, which this group will be part of that, and hopefully touching every piece of our strategic plan. So this is the beginning. Thank you.
Lori, Melissa, and then Amy Beckritz.
Hi, everybody. I'm Lori Andrus with the College of Population Health, Associate Dean, Associate Professor. This is my first meeting with the group, and I'm really glad to be present and to see everyone.
Hi, everyone. Melissa Rothleson, Executive Director and Professor in HISLIC, the Health Sciences Library and Informatics Center.
And Amy from Pharmacy. Beck.
Yeah, hi, thanks. And I am the representation from the College of Pharmacy, and I'm the Director of Community Outreach there.
Great. Just in the chat box, then Anita, Lindsay, Katie, and Amanda.
Anita Fernander, Executive Diversity Officer for the School of Medicine.
Afternoon, everyone. Lindsay Smart. I'm with the HSC Office for Diversity, Equity, Inclusion, and I'm also one of the co-chairs for our Workforce Development Committee. Nice to see you all.
Hello, this is Katie Reyes. I'm an anesthesiologist and the Assistant Dean of DEI in School of Medicine. I'm very happy to be here.
I think Mandy may have had to step away. I don't know, Mandy, if you're on, and then Amy Green, Roberta, Stacy, Gurdeep, and Ingrid. So Mandy was just on a minute ago. She's a MD PhD student, one of the School of Medicine reps. And then next up, Amy Green, Roberta.
Yes, hi everybody, Amy Green, she, her, hers. I serve as the director for our Communities to Careers programs at the UNM Health Science Center Office for Diversity, Equity, and Inclusion. So happy to be here to support you all.
Roberta, Stacy, Gurdeep, and Ingrid.
Hi, good afternoon. My name is Roberta Zayas, and I serve as one of the program managers in the Office for Diversity, Equity, and Inclusion under the Communities to Careers programming.
Hi, good afternoon. My name is Stacy Collier. I'm a program manager alongside Roberta for our Communities to Careers program underneath the Office for Diversity, Equity, and Inclusion.
Hi,
Gurdeep Singh, he, him, his, internal medicine physician, also diversity and wellbeing officer with most of my clinical work and scope for diversity and wellbeing being at SRMC. Thanks.
Hi, everybody. I'm Ingrid Hendricks. I'm the division head for Research, Education, and Clinical Information Services at the Health Sciences Library, and also the chair of the Academic Development and Professional Training Subcommittee for the IEC.
Great. Thank you, everyone, for introducing. Did we miss anyone? Okay. Well, thank you for that. I really want to take a moment. As you can see, you all represent many of all pretty much of the entities and the different communities here at the Health Sciences Center. So as we collaborate and work together, it's important always to start off with getting to know each other, not only in this space, but hopefully, in other spaces over the next couple of years. We'd like to start off with an acknowledgement, our land acknowledgement, and I'm just going to ask for a volunteer to read our land acknowledgement. If anyone could take a moment and read it out loud.
I'll be happy to do it.
Thank you.
So founded in 1889, the University of New Mexico sits on the traditional homelands of the Pueblo of Sandia, the original peoples of New Mexico. Pueblo, Navajo, and Apache, since time immemorial, have deep connections to the land and have made significant contributions to the broader community statewide. We honor the land itself and those who remain stewards of this land throughout the generations, and also acknowledge our committed relationship to Indigenous peoples. We gratefully recognize our history.
Yeah, thank you so much, Rebecca. So we're just going to quickly go over some announcements, and I'm going to ask if there's any other announcements that any of you would like to make. Next slide. And next slide. Just as a reminder, each IEC session is recorded. So just wanted to share that as noted at the bottom of the land acknowledgement slide. We are closing out Native American Heritage Month. I want to thank everyone for their contributions within their entity and across the Health and Health Sciences Center in supporting, supporting Native American Heritage Month. The final event through our collaborative efforts is scheduled for this Friday, December 1st, where we'll be giving out an Excellence Award or recognition for individuals who are advancing Native American diversity, inclusion, equity here at the Health Sciences Center. This is one of our staple activities of all the Heritage Months. Last year, we acknowledged many, including Ingrid, for her leadership around Disability Awareness Month. So please keep that in mind and consider nominating people for the Heritage Months moving forward. Next slide. As mentioned by Dr. Saridonis, and many of you have been involved in the production and implementation of our UNM Health and Health Sciences Climate Survey that was implemented, and we had 1,500 learners, faculty, and staff participate and provide information on their lived experiences with the climate here at Health and Health Sciences. The first formal presentation of the findings will occur at the Town Hall, which will be held on Wednesday, December 6th from 12 to 1:30. It is a hybrid event. We encourage you to be a part of it in person. We ask that you register so that we can order the right amount of food for everyone, but there is also a virtual option. Please not only try to be there yourself, encourage your community members. Once again, 1,500 voices are within this data set, and we hope to continue this project from years to come and observe trends and respond to the trends that we notice. Next slide. I want to take a moment and thank once again Dr. Laura Nervy for her service as Executive Officer for the College of Population Health. I don't believe that Laura is with us, but she has represented the College of Population Health since the IEC inception, and we just want to thank her again for her contributions and service. So if you see her, tell her thank you. I believe now she is on her way to retirement, but like many of us in academia, will still support the community in many ways. Next slide. And we're excited to welcome several new members, including Dr. Andres, who I've gotten a chance to speak with quite a bit, and we have many familiar colleagues that both of us know. So welcome again, Lori. Lori is representing the College of Population Health as the executive officer. Welcome to Rebecca Napier, our new Vice President for Finance and Administration. So excited that you jumped in and already are present with us as a part of the IEC. And thank you so much, Dr. Richards, for leading these efforts to excel and advance our health equity work as Vice President of Health System Strategy and Business Development. Next slide. I'm going to hand this over to Dr. Smart.
Okay, thank you. I am glad to just give a quick update on the Community Connection and Reflection Book Club. We are in the last book of the year. We measured the Earth with Our Bodies, and have had one session where we are talking about the book and building community, and then have a second session that will be in December. So encourage folks to check out the book at the very least, and do come join us if you're interested in talking about the book and how it intersects with our work here at UNM. We also have a new thing that we are joining with the Writing for Wellness with Dr. Flegg, and there's opportunities if you would like to engage in thinking about writing and the connection between many of these DEI topics and wellness in our professional spaces too. There's an opportunity to sign up for that, and if you're curious to learn more, feel free to reach out to me or Dr. Flegg and we can share more. We have our books selected for the 2024 year, working with HISLIC and our office, HSC, Office for Diversity and Inclusion, to get those books available. And we will have the same format with one book, every 2 months, and look forward to being able to share in that experience with you all. And there will also be a new opportunity developing more of an interactive Moodle space for folks who can't find time in the course of their busy days to join for a Zoom, or have a preference really to engage with folks outside of talking about books. So that'll roll out in 2024 as well. So that's the update. Thank you.
Thank you so much, Dr. Smart, for your leadership in the book club. I just wanted to highlight a book. Yes, it's a little bit of self-promoting, but it was a 3-year process in working with colleagues across the country. I had the good fortune of serving as a co-editor for a new book titled Latino, Hispanic, or of Spanish Origin Identified Student Leaders in Medicine, recognizing more than 50 years of presence, activism, and leadership. And there were a number of students, faculty, and staff here at HSC that helped contribute to this book from different departments, primarily in the School of Medicine: Dr. Ellis, Dr. Morales, Dr. Ramos, Dr. Rendon, Dr. Romero-Leggett, and Dr. Silva. This features over 1,000 individuals who have been a part of this 50-year movement. It has been supported by the Association of American Medical Colleges to be open access, which means that it's free to access around the world, download, and there's already been nearly 9,000 downloads since its launch. So please share with college students, high school, college, our graduate students, faculty, and staff. Thank you for allowing me to share that. And I believe this is our last update. Before we have Executive Diversity Officer Armijo give his presentation, any other updates or announcements that you all would like to share? Okay. Well, we'll also have a moment at the end of the meeting if anyone would like to provide any updates or announcements. With that, Executive Officer Armijo, Fabian, if you would like to start.
think you have to sign off, JP.
Oh, he had to sign off.
Yeah.
Okay. Okay. So let's move on. Thank you for that, Millie. While I call him, let's move on to our next presenter. If we could pull up.
It's me.
Oh, great. Thank you.
And I can share my screen.
Great.
Okay. Thank you, Dr. Sanchez. Let's see, can everybody see my screen? Is it showing?
Yes.
Okay. I never can tell. Thank you so much. So again, I'm Helen Nielsen. I am the Vice President of Human Resources for the medical group, and so happy to share some of the great work that we have done. Our journey has been one that's really taken root this past year, and so I'm really excited about sharing some information. So in the medical group, just some historical information. We are the faculty practice plan of the School of Medicine, and we have multifunctional work as the revenue cycle arm of the UNM School of Medicine. We support the health system functions in areas such as clinical contracting, telehealth, informatics. We serve patients from across the state in our unique clinical programs. We have about over 1,000 clinical practitioners, 152 specialties, and our providers serve as the primary caregivers at our state's only academic medical center. So, and we support UNM Hospital in addition to practicing at Sandoval Regional Medical Center. And we also have our own clinics and elsewhere throughout the state. So our reach is broad, even though we're considered a smaller entity in the grand scheme of UNM, but we do have support for all entities at the University of New Mexico. Some historical information. We have 11 clinical programs, 15 clinic sites, very diverse in the services that we provide. We have reproductive health services. We have Truman Health Services. We have a primary care center for life, which is the alternative health medicine. We support our athletes. We support Center for Development and Disability. We have a behavioral health clinic, a school-based health clinic, so we're embedded in some APS schools. We have dental, and we have telemedicine and locum tenens. So we have a bunch of different diverse clinical operations and under our umbrella. So our certifications are pretty widespread as well. We have our Truman Health Services. This is just a snippet of what they do, but they provide safe zone training for all medical UNM medical group staff. They do the Stay Humble training for all of our staff. Our recruitment team has recently gotten certified in DEI certifications for all our team members. So this enables them to recruit from a diverse population and spread our net far and wide so that we are getting the best possible candidates for all of our roles. We also are a member of Diversity Jobs, which is an organization that helps us recruit from a variety of websites that really help us to cast our net again into those populations that we might not otherwise see our job postings. So really working hard on our recruitment front to bring together a more diverse and reflective population. Some of our highlights of our DEI activities in our community. Our previous locums director, she was a co-chair for immunization equity at a national level. Our locums providers, they provide care for all our rural and underserved areas. We have providers and community health workers that provide health care for our homeless population, and we continue to foster that work in our community. Our Center for Reproductive Health has been seeing an uptick in volume and currently taking patients from other states surrounding our community. And we also hold several designations for family planning that includes bilingual services. We have our primary care clinic that is specifically focused on DEI initiatives in their practice for Sandoval Regional, Sandoval County, and supporting that population. Truman Health Services has expanded their services into Roswell, New Mexico, and continues to be very active in the local area here as well. On climate and culture, our senior team is adopting a management system that includes DEI initiatives in all of our standard work. And we have an affirmative action plan that is built, that we build around all of our action planning and help to strategize how we can improve in that arena. A DEI collaborative was formed just this year, and we're very excited about this. This was new to us, and I really want to thank a lot of our colleagues, such as Dr. Singh and Fabian, for helping us, and Dr. Sanchez, you've been incredible in helping to build this collaborative. And we have charted our mission and vision, and we also have a really great set of questions. We're going to do our own little survey to help us chart our course on what our next steps and tactics will be. Kind of going back to what Dr. Ziadona said, what it will be our 5 takeaways from that and going forward. We also really look at our Press Ganey employee engagement action plans, and we have action plans for all of our leaders in the work around DEI. Continued on with the highlights on our academic and professional development. Our dental clinic contributes to mentoring of new faculty and staff in the areas of DEI. Our athletics department, a lot of our athletes are not from our community or even from our country, and so really providing healthcare and services for them. We are a leader for in our a leader from our CDD clinic has been selected to participate in a national cohort of influential leaders within universities, Center of Excellence in Developmental Disabilities, and she consults on these goals in the area of at a national level. Our medical director for school-based health is a practitioner on the NIH-funded study implementing school nursing strategies to reduce LGBT adolescent suicide. So that's an important work that she's been taking on. On our workforce development teams, we continue to score high in the area of DEI in our Press Ganey employee engagement survey, as it is a focus of ours. We recognize that we had a siloed approach to DEI. A lot of our clinics had DEI approaches. A lot of our departments had DEI approaches, and building our collaborative has really helped us tear down some of that silo work and really unify us. And we've undertaken a significant change in the approach to our compensation philosophy. And really this has been helped us enable us to address pay inequity and continue to ensure pay practices are implemented with that DEI approach and fixing inequities in real time, and also preventing any inequities in the future. We also promote wellness with a monthly wellness newsletter for all employees. This newsletter includes internal and external well-being resources, and we are a diversity jobs employer member, and that helps us really get our word out about who we are at the medical group and hiring on a diverse level. And we were the Grand Marshal of the Albuquerque Pride Parade. Truman Health Services was that Grand Marshal, and it was an exciting event. We also participated in the Roswell Pride Parade for the first time this year, and so really becoming more part of that community and helping that population in Roswell, New Mexico. So I'll stop sharing now. That concludes my presentation, but thank you so much for listening to me and getting to know the medical group and all the work that we're doing there. Any questions?
Excellent presentation. Thank you so much, Helen. So I'll just comment on one thing. Thank you for organizing the content around our work groups. That was stylistically a really nice compliment. So thank you for taking that effort. Lori?
Hi, Helen. I'm curious to get some more information about the Press Ganey DEI score or set of questions on Press Ganey. Can you say a little bit more about that or send some information?
I can send some information. I don't have those questions at the tip of my fingers right now, but we do have a set of questions. Since I started in 2020. We have expanded the cadre of questions in our Press Ganey survey, and this is on the employee engagement Press Ganey survey. So I can certainly send out that listing of questions to this. I guess I could send it out to this group or to someone that could disseminate it, and so you can see what that will look like. I am not sure, because the Press Gaining survey is coming up in the spring, if we will be adding in any more questions there. I think we are, but I don't know what that looks like for the next survey, but I can definitely send you what we did on the last survey.
That would be great. JP, I can send a request to Amaris and then she can get it to Helen if you just want to do it that way. Okay, thanks.
You know, as a prior epidemiologist, what I love is these standardized instruments that we're using to gather information, whether it's Press Gaining on the hospital setting, whether it's the matriculating student questionnaire at the medical school, and now with our climate survey of 1,500 respondents. From the medical group perspective, Helen, what have been the historical surveys that are standardized, used on the national level, that you've been looking at to better understand the environment, the climate amongst medical group staff? Is it primarily the Press Gaining, or are there other instruments, standardized instruments that you use?
At this point, it has been the Press Gaining. That's been our source of truth for DEI feedback. And historically, we have scored fairly well in that arena, or that subject. We slipped a little bit last year, which was interesting because we have put more focus into that area as of late. So that's why we are digging in and asking our leaders to create more action planning around that subject, to get at the root of why it might have slipped, and what we can do to make sure that we're promoting it even more. I think with the building of our DEI collaborative, we are going to disseminate a small, brief survey, and that's gone out already, just to help that group identify some key strategies and tactics for implementation in 2024. But that'll be a new development for us on data. And then we're looking forward to seeing from the climate survey if we can glean any information on who responded from the medical group.
Excellent, thank you. I think Anastasia has a question. Did you want to share it, Anastasia, or?
Oh, the healthcare for unhoused individuals. We do that primarily through community health workers, through our Truman Health Services. They go out into the community and really try to help those in need. And they have built out a really great network of individuals that have worked in that community, working for the unhoused and providing services there. So that is really our flagship clinic that works in that population. And also subsequently, our other clinics have helped out when needed as well. Did that answer that question? Okay. And Anastasia, if you want, I can get you in connection with, his name is Craig Labarge Esparza. He heads up that initiative with Truman Health Services. He also heads up our DEI collaborative.
Excellent. Any final thoughts or questions for Helen, and or any announcements? I just want to share two final thoughts, and feel free to interrupt me. I'm an ER doctor, so if anything comes to mind, please speak up. But one thing that we sort of alluded to the town hall, remember that we've spent quite a bit of time to provide a web page that provides an update every step of the way of the design, implementation, and the presentations around the findings in the climate survey. You can share this link and information with your community members. It's also an opportunity where people can submit questions for the town hall speakers and to sign up. And it provides some early data on, how many people participated. To your question, Helen, we will be able to provide some additional information on breakdown by entity, just grossly, but not at this point to tease out specifically what respondents from medical groups stated for each of the variables. The one thing a couple of things that came to mind as you were delivering your presentation, just as a reminder, we all have surveys, standardized surveys that our institutions have been involved in, right? So you mentioned Prescaney, I mentioned the School of Medicine, and as we build on another survey, this climate survey, it is on us as DEI leaders to think about how the findings from the climate survey complement the other data, right? So really, it's sort of a meta-analysis, taking all this data to inform where we stand today around environment, culture, and climate. And then the second thing I really appreciated you saying is, what are the action steps? So just as a reminder, just like we collaborated on modifying the standardized survey and implementing it amongst our community, what are the action steps that we're going to take and track year to year until we implement the survey again? So please keep that in mind as you come to the town hall, but also you encourage others to come to the town hall, and maybe even encourage people to review the surveys that have been used historically and the action plans that have been created historically, and thinking about how the new data will inform modifying those action plans and those strategic priorities. So I believe that Fabian is still away on an emergency. We won't be able to hear his presentation today, but we'll invite him to present at a following IEC meeting. And I think that's pretty much what we have on the agenda at this moment. Are there any closing questions or comments before we conclude?
I just wanted to thank you all for the warm welcome, and I'm excited to be part of the group. So I look forward to getting to know you all better and rolling up my sleeves and getting to work with you.
Thank you so much, Rebecca, and congratulations again. And we're excited to have you leading here.
And I don't know if you saw in the chat, I actually have the opportunity to meet your dean there in Puerto Rico last year at the AAMC. And so I know you're going to a great place, and they're going to be very fortunate to have you. Sorry we didn't get the chance to work together.
I appreciate it. Thank you so much. So now you got to come down. You met the dean. We've met. You got to come down. So
twist my arm. I'll be there. We'll figure out something. I think people are putting paths together for a reason. So let's figure out ours.
Awesome. Well, happy holidays, everyone. I'll stay behind if anyone has any questions or concerns. Otherwise, have a great month. Take care.
And thank you for all your work, JP. We're going to miss you.
Thank you so much, Ingrid, and for the help recently.
Thank you, Dr. Sanchez. I appreciate your leadership.
Thank you so much, Helen.